Dr. Allison Rodgers with Fertility Centers of Illinois. I often get asked, what do you need to know about the IVF laboratory to know whether it's a good laboratory or not? So first of all data from laboratories get published on a website called SART. It's SART.org. The data is a little confusing because some of the best clinics in the country will take the hardest cases. And so sometimes it looks like their data might be lower. Some of the not as good clinics may turn away patients who may not be very good prognosis to make their numbers look better. So it is important to take those numbers with a grain of salt. However, you can see in general how many cases clinics are doing, how many egg donation cycles they're doing, how many gestational carrier cycles, those kind of things. And the more volume a clinic has, the more experienced those embryologists are because they're busy doing things on a regular basis. It's important that when you go through this process to make sure that you're with the laboratory that has the highest equipment, highest tech equipment, and has the best technology to really help you get the best eggs, the best embryos, and of course, healthy babies at the end. So I think it's important to sort of ask those questions about numbers. And another question to ask is how many single embryo transfers they're doing. If a lab is really good, they can get away with transferring one embryo most of the time because their lab is so good they can maintain the rates by putting in fewer embryos. So I think those are some important questions to ask. I will tell you, when I went through this journey, I did not, this was years ago when I was in training, I drove to an office that was 3 hours away so that I could have the best laboratory possible. Because as good as us doctors think we are, it's all about the lab.